Now, you know what's very interesting about your mission is it's so similar to what Hispano Care does, and as far as our mission and everything that we do for the community, which is great. Now, tell us about the respiratory therapy program.
Right. The respiratory therapy program is the one allied health program that we have at St. Augustine College. That it's a very powerful credential. It's a 2-year to 3-year program, depending on how many prerequisites an individual student has to do. And it gives you an associate degree and a certification that allows you to work as a respiratory therapist, and this is a growing field where people can work either in hospital settings or nursing homes or other elderly care type facilities, and provide services always related to breathing, mostly helping with breathing therapies as well as some sort of massage therapies with the back that they do on the back, and a variety of other skills associated with that. And we found it to be a particularly useful certificate because most of our students, when they go through this program, and it's a demanding program, it's a program that requires people to be very serious about their studies, they find very fulfilling careers as they move on.
It sounds like a very versatile I mean, as far as graduating from this program, it sounds like something that's very versatile that could take you in many different directions then.
Absolutely. You can work almost any setting that you can think about in work with health. You would find respiratory therapies, including doctors' offices.
And that's the great part about healthcare fields. I mean, it could take you in so many different directions, so that's great. Now, what are the requirements and what financial aid is available?
Right. Just jumping to your point, it's also allied health in general, respiratory therapy, but allied health in general, it's also recession-proof fields, which is also important to point out. Particularly in this difficult time, if there's one thing that's not going to be outsourced to another country, is health. We're always going to have people that are that get sick, for lack of a better term, and they will need support in one way or another. I'm sure some aspects of healthcare may be outsourced to different parts, but you will always need people taking care of people. And for people who feel that that's a calling in life, it's a fantastic field to enter. But moving into the requirements for our program, any high school graduate or completer of a GED program has access to be admitted to our respiratory therapy program. Even people that have not completed high school or the GED have a way of beginning their studies with us at the same time as they complete the GED requirement. And the first step is to take a series of what we call prerequisite courses, which lead towards the degree. But these are sort of the general education requirements that help prepare people for what are very intensive science courses later. So you take English composition and biology and a series of general education requirements that first prepare you, and then you go into the actual theory courses on ventilation and a variety of other courses related to respiratory therapy, before then moving into actual rotations in hospitals, where you have to go just like a nursing program or other allied health programs. You have to go through different rotations that include pediatric units as well as adults and so on, in order to learn all the aspects of how this is done. And part of St. Augustine College's work is to have made this contact with hospitals throughout the city where students can fulfill their rotations, and we have all these clinical agreements with the different hospitals in the Chicago area so that our students can benefit from that. It's also a great opportunity because many students end up being hired right there where they're doing their clinical.
That's great.
Clinical rotations.
That's great. No, that's great. It sounds like you definitely do assist them a lot along the way. That's great. Now, why is this a field that is in high demand? I know you touched on it a little bit. A little bit. Are there, as far as respiratory therapy, the statistics with just
right? It's not unlike other healthcare fields that it's always important to point out. It's one of the few areas where everybody's actually hiring. I mean, hospitals need more and more people as our population ages, and it's a reality in the United States that as the population ages, you find that there's more and more health needs in society, health services needs, and that means that all fields have been growing, and respiratory therapy has been growing in particular. Part of it is the urban environment that leads to more breathing disorders and issues like that. But we see an increasing need for respiratory therapies, and so far as we know, absolutely all our graduates that have searched for employment, the moment they graduate, they have opportunities. We have people that enter full-time jobs immediately after graduation. We find many students have chosen to actually do fewer hours than 40, let's say if that's a full-time job, during a night shift, and that leaves them the days open, but the remuneration they get on a night shift is comparable to having a full-time job during the day. So they're very happy with that. And another point, Daniel, I wanted to mention that I forgot earlier, is that St. Augustine College, our philosophy is that we understand that we serve a population that has not always had access to higher education, and one of the reasons people have difficulty accessing higher education, it's financial, is the ability to be able to afford a higher education. So we always work very closely with all our federal and state programs to provide financial aid packages so that the great majority of our students actually do not pay out of pocket, but we find scholarships through the federal government and the state government principally, but we also have our own fundraising resources where we give over $1 million in scholarship out a year to different to students in all our programs, but respiratory therapy is included in this. So we try very hard to make sure that our students, when they graduate, do not have a student loan debt, which is an increasing problem in our society. Yes. That students are graduating with huge debts that a started salary cannot accommodate. And so our students, when they graduate, they have no student loan debt, or very minimally in some cases. But talking about the high demand, it's an increasing field. We have many cases of graduates. I know I've interviewed several myself in respiratory therapy who have chosen to work 2 or 3 12-hour shifts because they have children. Women that have children and they want to stay with their children during the day, or they want to be available to pick them up from school. So they do this 2 or 3 shifts, long shifts a week, but then you have the rest of your time for yourself and your family. That's so great. It's a wonderful career for people who are interested in helping others in the area of health, but at the same time, if you're interested in having a fulfilling life with your family, with your relatives, with your community.
Sounds like a great field. It sounds like you do have a lot of versatility, and it gives them a quality of life. That's great. Now, how much could a respiratory therapist expect to earn?
Well, that varies from location to locations, and some make more than others, depending on the type of resources for the organization to work. My understanding is that most of our graduates are making, starting in their area of the 40s to 50,000 a year as a starting salary. Then we hear great stories from our graduates that have been at the hospital for 4 or 5 years, and they're earning more than most of our professors. Wow. And in fact, sometimes it's even difficult for us to hire faculty because they make such good money in the actual field. This is also true in other allied health programs such as nursing. So it's a field that will allow people, if you graduate in this field, will allow people to fulfill what are the dreams of most of us in society. I mean, we're all all of us are looking for the same things. We all want to have a decent life. We want to be able to afford a home, take a vacation every now and again, pay for our children's education, higher education in the future. That's what we all want to do, and this is a field that can truly do that. And if you apply yourself, you can actually reach that in a shorter period than some other fields. You can do this in 2 to 3 years. So it's a wonderful opportunity for people that are interested in health and working with people and providing healthy environments. Respiratory therapy might be a field that not everybody has heard about. You may have come across respiratory therapists in a hospital, but you may think of them as nurses. But they're actually a specialized field and one that could be very rewarding.